If your trauma didn't start with you, who did it start with? My guest today is Dr. Johanna O'Flaherty. She is a transpersonal psychologist and a crisis psychologist, and she is going to be answering that question, and I am very excited to hear what she's going to say. Welcome to Soul Transformation, Dr. Johanna O'Flaherty. I'm so thrilled to have you here. So the question I want to ask you, if your trauma didn't start with you, who did it start with?
Well, thank you, Dr. Selina, and I am very glad to be here. My focus is on healing ancestral trauma. So when we look at the individual that right now would come into any psychological practice wanting to work on their trauma, we also need to consider what is the origin of this trauma? But I want to give your audience hope from the get-go. It may not have started with you, but it can end with you. And so when we talk about ancestral trauma, it could go back multi-generations. Obviously, many of these generations, our ancestors, they're deceased. Nevertheless, the trauma we know can be transmitted, and it can be transmitted non-verbally. So the individual that will show up in one of our practice, in a psychologist's practice, will have all of these issues, and perhaps they're not cognitively aware of where they came from. However, we as therapists, we treat the symptoms. We do not give the individual a false memory. We had a lot of problems with that back in the early 80s. But this work of transformation and healing ancestral trauma is very, very exciting work, particularly because it is a work that gives the individual liberation.
Yeah, absolutely. You had said something to me. I'd heard you lecture, and you said that which is not transformed is transmitted from one generation to another. And that has sat with me forever.
Exactly. For instance, if my grandmother had issues, and let me give an example. Let's say my grandmother was sexually abused. I have no idea. I'm using this merely as an example. And she had absolutely no opportunity to get the help that she needed. She would transmit the fear of that onto my mother, even non-verbally. And my mother, in turn, would transmit it onto me. And I would go around with a fear, quite frankly, of experiencing the same situation. So that's just an example. And we need to be cognizant of the fact that we do not develop in a silo. We develop in a family unit. We develop in a community, but we also heal. We heal.
Yeah, absolutely. Now, is there a difference? You talk about ancestral trauma and you talk about transgenerational trauma. Are they the same thing? Are they different? Or how do you explain them?
But Dr. Selina, they're basically the same, and they are described they're interwoven. I personally choose to use ancestral because everybody gets that, and we have a great body of wonderful work from the indigenous people and healing ancestral trauma. And so my preference is healing ancestral trauma.
Okay.
You might have transgenerational, but if you're adopted, uh, you don't necessarily come from that necessarily generation. So who are your ancestors?
That's a very, very good point. Uh, you talk about epigenetics. Can you explain what that is and the effect that that has and how it deals with trauma?
Yeah. Well, epigenetics is a relatively new study, and I'll just give a brief, description of what it is for the audience, uh, particularly from a behavioral standpoint. Epigenetics in psychology is the study of what role genetics and environment take in the shaping of behavior. Essentially, this is the study of how nurture, the upbringing, and the experiences affect the shapes the behavior of the individual. So That's essentially a very simple explanation, but I think it suffices for this interview.
Yeah, no, absolutely. I think you did a really good job of handling something really complex and simplifying it for us. So, do you think that trauma affects a person's health?
Absolutely. There is, for your audience, if they're interested in further exploration of the correlation between trauma and subsequent physical disorders, there's a wonderful study out there, and it's called the ACE study. ACE is obviously the abbreviation for ad, adverse childhood experiences and the subsequent health issues. So they know they did an incredible study, uh, and they have, concluded that adverse childhood experiences, trauma, has obviously adverse consequences on the following illnesses: cardiovascular, diabetes, cancer, gastrointestinal, autoimmune, hepatitis, depression, suicide, and indeed substance abuse.
I mean, incredible. That is incredible. That's like so much of the problems that we see in, I mean, the psychology room, and I'm sure medical doctors see this all the time. So all of this, and actually, I'm going to jump to all the trauma that we have in our culture right now. We have the Ukraine, the COVID, Black Lives Matter, climate change, LGBTQ, the mass shootings. Like, we are traumatized as a culture. So we are being affected, not only, with our, family ancestral trauma, but also from the trauma that that we're having every single day. I mean, how do you think, how do you see that hitting our bodies?
Yeah. That's a very good question, Dr. Selina, and I think we have to tease it out a little bit because I use a very simple illustration. If you can just imagine a dartboard, sort of the inner circle of the dartboard, and then there's a secondary circle and there's a tertiary circle. Well, the inner circle really would qualify as the major T traumas. The individuals that have personally experienced emotional, physical, sexual abuse. Uh, they're definitely, and then I also do a lot of work with first responders, so they would fit into the inner circle because they have touched, smelt, and visually seen horrific situations. There's a lot of people in right now in the Ukraine that fit into the inner circle. There's a lot of people that fit into the secondary circle. Family members, and they're here in the United States. Their families are in Ukraine, and they're absolutely very worried about them. Then the tertiary circle, quite frankly, is all of us that have a moral purpose and seeing man's inhumanity to man, quoting Viktor Frankl, man's inhumanity to man and what they are doing. I mean, this is the tertiary circle. We're all suffering from some way or another of, what I would call, vicarious trauma. However, uh, you know, uh, we will experience it, and hopefully, collectively, we will be able to break it down into regional areas where regional and then categorizing inner circle, secondary circle, tertiary circle, and begin the appropriate process of healing for these individuals.
Yeah, one thing I want to address that we're all seeing on CNN, we're seeing President Zelensky change. His face is changing, his body is changing. All the members of parliament that are on CNN and MSNBC and Fox, you can see how the trauma has affected how they look. I mean, it's quite shocking. So the trauma is actually being embedded in them, and it's shifting their whole nervous system, I would imagine.
Absolutely. There's a wonderful body of work out there that focuses on the body keeps the score. It's by Van der Kolk, and As you know, Dr. Selina, I've responded to major aviation disasters and really to support the human factor aspect of it. And I have personally seen a mother who lost her child on board an aircraft. The aircraft exploded over Long Island Sound. She actually went grey within 3 weeks. I also happen to know an airline captain, a female airline captain, who was in a horrific aviation disaster. She was flying the aircraft. She went grey. Her whole hair turned grey within 3 week period. So does trauma affect us physiologically? They're very, very poignant examples that I have personally witnessed. Absolutely. And I want to say also for the audience, we noted, gastrointestinal and cardiac and so on, inflammatory, inflammation. And so many times, if we've experienced trauma or indeed are triggered by trauma, uh, if we have an autoimmune disease, it kicks up. And we kind of sometimes are challenged with trying to make the correlation. So just be aware of the fact that if you have an autoimmune disease that um, elevated inflammation has an effect on all of the preceding what we talked about, cardiovascular and so on. So we need to be very, very aware of how trauma affects us.
Oh, absolutely. Absolutely. So, what you're saying is each person, the way that they handle or they experience their trauma, or how it gets embedded in their body, depends on their their own personal genetics.
Uh, well, absolutely. And the other thing going to come into play here is, you know, what this individual, what support and what ego strengths did they have prior to the age of 10? If they had a good enough parenting, they will be able to process their trauma because they've had a foundation. I used to do a lot of this work. As a matter of fact, I worked at the Betty Ford Center for many years, and I would do a lot of work on the correlation between trauma and addiction, subsequent addiction. And when I pointed out, and when the individuals did their timeline, and we would put the positive aspects of life above the baseline and the painful situations below the baseline. And when I looked at the timeline and when I saw the individual that had good enough and good enough ego strengths prior to the age of 10, and you can see it so clearly on the timeline, versus the individual that was abused from the age of like precognition.
Absolutely. And that kind of brings me to COVID and what is going to be happening to all of our children that have been affected by wearing masks and not being able to see and not being able to, they're going to be missing certain developmental milestones that are never going to come back in this generation. And that makes me very sad. Would you agree with my perspective on that?
I think, Dr. Selina, that your perspective is dead on. Uh, individuals are incredibly resilient. As long as these children feel safe in their homes, they're not bullied at school, will go on to positive recovery. And we don't really know the outcomes yet, but we do have some research. Children that were sick and were away from school for a long time due to an illness, a major illness, and had to be homeschooled, they actually survive and thrive. But so collectively, I think it's a little premature for me anyway, to come to any conclusions. But definitely, it is not going to be a positive. It certainly has affected everybody. But again, if they have the security of knowing that they are supported and they are safe, and this is what I always, encourage the parents, the young parents, let the children feel safe, assure them that they are safe, even quite frankly, even though there's a lot of things happening in our world that we have no control over.
Right. No, I think that's a very valid point, Dr. Johanna. You say psychological trauma. is an affliction about the powerless. But isn't trauma for all of us an issue? Isn't it emotionally harmful for all of us?
Is. Yes, it is. Psychological trauma is, you know, of course, it is emotionally traumatizing for everybody. But when I say that trauma is an infliction and the individual is rendered powerless, when one is totally traumatized, particularly on the inner circle, you are powerless. You are at the time a victim. You're being perpetrated. However, the work of healing trauma is move from victim to survivor. So back again to our circles. Uh, here is, and trauma, and I want to use a quote here. Um, Trauma does not toughen the individual, but it toughens their defenses. And when the individual comes to therapy, to my practice, or into a workshop, I actually invite them to honor their defenses, albeit the defenses were maladaptive. But they saved their life. But now, as we begin, teaching healthy tools, they don't need the maladaptive behaviors anymore. So they can let go of those and they can start beginning applying healthy behaviors. And they can let down their defenses because what happens, as you know, Dr. Selina, with defenses is the individual can't get out, but we also can't get in help. So, as trauma therapists, we have to come around in a very circuitous, gentle way.
No, absolutely. I agree. Working with a lot of PTSD clients, their levels of sensitivity are so high. You have to be very, very careful and always to go around and under and never direct is a better approach. Do you think trauma can affect the way that you think?
Oh, absolutely. Matter of fact, trauma affects us in the following five areas. This is important for your audience. Trauma affects us cognitively, which is thinking. Emotionally, we begin to see the world through the lens of a trauma survivor. It affects us behaviorally. We keep sabotaging ourselves. We talked about how it affects us physically and it affects us spiritually.
Oh, absolutely. I mean, all of those different things. You talk about reenactment. Can you develop that piece?
I'll be glad to. As a matter of fact, uh, reenactment is a term that Dr. Freud used. And I actually, while I'm really trained more or less in a depth psychologist studying Dr. Carl Jung, uh, reenactment and continuing the same sabotaging behavior, as strange as it may seem, is a cry for help. So I ask therapists, and particularly younger therapists, what is the behavior trying to tell us? What is the behavior trying to tell us? Let me give you an example. So a young female, I'm taking the female gender, a young female, it can also apply to a male, a young person that was sexually abused as a child. They're aware of it because they were abused, let's say, after the age of 5, and we'll talk a little bit in a while, I hope, about brain development. Um, and they, of course, then absolutely swore they would never, ever allow anybody to perpetrate them the way they were perpetrated as a child. They grow up to be teenagers and they develop a substance abuse disorder. Invariably, they will put themselves in a place where they can be re-victimized.
And that's unconscious. That's completely unconscious. They don't know that they're doing that, but the unconscious patterns live within us, and we set ourselves up without knowing it, which is what we have to teach a lot of people because most people don't get it.
Absolutely, you know, they don't know what they're doing. And when you talk about their unconscious, they're anesthetized because they're under the influence of either drugs or alcohol. and they are reenacting. But it's also very liberating when I work with individuals and they come to me and they say, "Oh my God, Dr. O'Flaherty, I'm so ashamed. I'm so ashamed. I was, molested as a child, and then I developed a substance abuse problem, and then I put myself in a place." They don't know the word reenactment. So I ask them, "Were you under the influence?" And they say yes. And now these are usually individuals that are making a commitment to begin their healing. And of course, their healing journey means they need to be free of any mood altering chemicals. And so I say to them, I can guarantee you one thing, not very much, but I can guarantee you one thing. If you, first of all, you were under the influence, so if you begin the commitment to begin your recovery or your healing journey, you will not put yourself in a situation where you can be re-victimized. Do you realize how liberating that is for individuals?
Unbelievable, because they are making the choice to move their life forward and move it out of the toxic environment or toxic patterns that have been set with their life. So they take a different route. It's wonderful. What a great
So that is a good example of reenactment. We all do it, maybe on a lesser scale. For instance, if we come from a family of wealth and we haven't quite, established our own careers and so on, there might be guilt and shame about uselessness. If we come from a family of poverty, unless we know how to, and we've been taught how to manage money, we can have a very unhealthy relationship with finances. That's another way of reenacting. I gave you quite a severe way of reenacting, but there are milder forms of reenacting. I have many people in my practice who come from a variety of backgrounds, and there's sabotaging behavior, and it could be classified as kind of reenacting. But once it's pointed out to the individual, it's kind of like that aha moment. Then we can begin to heal.
Right. And that's the most important thing, the transformation, the soul transformation part of it, which is what I'm really into. Tell me about trauma and the brain, because that's a whole other topic that's
Yeah.
really important.
So I've been doing trauma work for over 25 years. And thank goodness, at some of the teaching hospitals and university, they've been doing a lot of brain scans, I don't know, maybe the past 20 years. And they've established the fact that trauma changes the structure and function of the brain at the point where the prefrontal cortex, the emotional brain, and the survival brain converge. There's a part of our brain for any young mothers that are watching this and fathers. There's a part of our brain which is called the hippocampus, which doesn't come online, so to speak, until we're 4 or 5. So therefore, we can't interpret. We will feel, but we can't interpret sensory input. What does that mean? If somebody's been verbally abused, physically abused, emotionally abused, if there's chaos in the house, the kid doesn't know whether to get out of the way or stay in the middle and try and break up the fight. So we need to understand that now, when these children grow up, they're not going to have the implicit memory. So therefore, they're not going to have a way of expressing themselves. However, their body is going to remember. So that indeed is, a very, very brief overview of the neurology of trauma.
Tell me the importance of resilience in regards to trauma.
Uh, yes. Let me see. I did pull out something about resilience, and I want to make sure that I give your audience what I pulled out. So let me be very resilience. I can't find it. So here's the deal, guys. Resi-
Okay.
re- Resilience really is a way of resisting, resilient, and making a commitment to our own healing, our own recovery. Ladies and gentlemen, those of you that are listening to this wonderful podcast by Dr. Selina Matthew, trauma is not a life sentence. We all recover from trauma. And, there's resistance to doing the work. But here is the good news. What price do we pay for not doing the work? We pay a price of psychological bonding. But here's the good news. The psychological and emotional liberation, we do the work, phenomenal. There's a congruence then of what you see outside and in match. So
Wow. Yeah. No. Absolutely. The resilience of having to have the energy, the force, the soul force for transformation has to be one of the most important things. And I think that the importance of making change and doing the work and digging in and going through the pain and coming out the other side really develops character. And none of us like to, when we're in the pain, we don't like it, but we have to go in. We have to go to those dark parts of our psyche, our soul, so that we can get through to the other side. There is no other way except going in, digging it out, moving it out, transforming it back into the universe. And that's not easy work, as you know.
that's very, and I would encourage the audience that this is work that cannot be done alone. It cannot be done. We're traumatized in isolation, but we heal in community. Now, many people are out there that are going to be listening to this that really can't, frankly, afford a therapist. So, my recommendation is do have a couple of very trusted friends. Are you in a sort of a recovery program, finding a sponsor? Are you in a faith based community? Finding somebody that you can trust. Be very careful that you choose the right person, because you don't want to be re traumatized. Because many people are traumatized and they can't afford therapy. Therapy is a luxury in our world.
Yeah, but there are a lot of places. I mean, I live in Los Angeles. I know you live in Las Vegas. There are many places here that, teaching institutions where you can work with interns for a very, very low fee. I mean, some of them charge $25 a session. So most people can be, pay for that per session. So there are places. It's just that they're really hard to find because the onslaught of people trying to go there would be enormous. But there are places. There are definitely in LA. I can think of 3 or 4 at the top of my head. So I'm sure every major city will have some, and I know there's probably some in Las Vegas too. You
Yes,
know,
there-
but I mean, you could have your own therapist for a lot of money. We do charge a lot, but people don't really realize we've been to school probably equal to a surgeon. So our psychological education is equal to a surgeon. So that's why we charge what we charge. So,
but it's a very good made that universities, the School of Social Work, and so on, and community resources. So absolutely there is, and don't feel that you're alone in this. No, you're not. And I want to encourage your audience that by doing the work, you're going to be more. You see, trauma fragments our psyche, fragments our soul, and going through the trauma, working through the trauma, repairs, brings the individual reintegrate.
right. What about self care? How important is self care for individuals?
Self care is very important, and I made a little bit of list about self care. First of all, here's the good news, and this is a quote also from van der Kolk. Our brain will take in new information as long as our body feels safe. Now, people will try to do their trauma work, and if they're not in a safe place, and if they're in an abusive relationship, they can't do the trauma work. If they are in an active addiction, they're very possibly going to reenact. So it's not the ideal time to do the trauma work. But if you're in a safe place and the body feels safe, you can do the work. And the trauma needs a witness. So, before I get into that, guess what, ladies and gentlemen? I found resilience. And so, resilience is a term, it refers to the ability to rebound from psychological trauma. Uh, and the term recovery and resilience refers to the ability to literally recover, the ability to adaptively function, both psychologically and behaviorally, in the wake of significant distress uh, or impairment after a dysfunctional event, traumatic event. So, we talk about self care. And here in the United States, as those of you that are listening, you might figure out that woman has an accent. Yeah, I was born and raised in Ireland. So, but here we're so good at taking care of ourselves externally, which is great. But we also, again, need a process of integration. It's both external, uh, intrinsic and extrinsic. We need to take care of both. So a few things that we know over the years that has been very effective: mindfulness, yoga. There's so many things online. You don't even have to go to a studio. Yoga, acupuncture, nutrition and diet is very, very important. We try to do, trauma work. We try to get this spiritual nirvana. Look at your basket when you're checking out at the grocery store. It's full of junk. So diet is very important. Then there's bio and neurofeedback, aromatherapy, massage, meditation. All of these things are very, very beautiful healing ways of healing from trauma. Because remember, the trauma is the head and body are not separate from the trauma. It is what we call psychosoma. So both need to be brought online, as I call it, brought online to heal. For a long time, we were just doing talk therapy. Not very effective. The body needs to be involved. Because when you have a trauma trigger, there's a visceral response.
Absolutely. Absolutely.
Yeah.
So, can your trauma, Johanna, move you into a spiritual awakening? That's the question I want to end with.
Yeah. Uh, yes, indeed it can. Yes, indeed it can. I use an expression that a traumatic situation can be an earthquake of the soul. It's kind of an image for people. Now, healing the trauma. Beautiful, it's like sacred work. Healing the trauma, forgiving yourself for reenactment, and because I think one never forgets. We talk about forgive and forget. No, one never forgets. Forgiveness comes when you are on that journey of healing yourself and maybe for the others. Uh, then, if my expression of that trauma is an earthquake of the soul, 9/11, my God, what's happening now, personal, psychological, emotional, sexual trauma. When we begin integrating, healing the trauma, I believe we're integrating the soul. And the soul, actually, as Dr. Carl Jung says, the soul is the reconciler. So the soul will help us heal. So, absolutely, healing from trauma is a major uh, transformational spiritual awakening and transcending our level of conscious awareness.
Wonderful. Is there anything else you want to add as we close this um,
Yeah. I
podcast?
first of all like to thank you, Dr. Selina, for inviting me. And I want to say to all of the your audience, I've been doing this work for years. I've experienced trauma myself, and I'm really a great witness to let you know we can survive and we can thrive. And I would just like to say blessings and a big hug on your journey.
Wow. Thank you so much. It's been just such a privilege sitting here with you for this hour. Thank you so much for being part of Soul Transformation. I feel very blessed.
Thank you for having me.